Nice to see you here. In respiratory care, every second counts, and comfort matters just as much as performance. Introducing the Devilbiss Vacu-Aide QSU, the quiet, powerful solution for airway clearance in any setting. Let's talk about what some of those settings might be. So first off, we have trauma patients, right? There's a man down somewhere not near a hospital bed, not in a hospital setting. We need a portable device. They're laying down, they have blood in their mouth, and we need to suction it out of their airway. The only way we'll be able to do that is with a portable device. What better portable device than the Vacu-Aide QSU? Quiet and reliable, and we'll be able to get everything out because of how powerful it is. Suction it out of the airway. We also have seizure patients, right? We have potential excessive secretions, we have vomit in the airway, we need to get that out. The only way we could do that, if we're not in a hospital setting, with a bed, with a suction unit right on the bed, is if the Vacu-Aide QSU, we could suction out the excess secretions and the vomit out of the airway. Right here, we have Jamal. He's a respiratory therapist. He's gonna show us exactly how we might suction somebody's airway out of a seizure patient.
Yeah, I'm Jamal. And here, as you can tell, we have a seizure patient right here. They have thick secretions coming out, a lot of mucus going back and forth, and now we're gonna be using our Vacu-Aide. So we're gonna go ahead, put our tube slightly into the mouth, and we're gonna turn it on. It's quick, effective, efficient, strong, and quiet enough not to stress our patients.
Hey, I'm Sean here at Carrington College as a respiratory student. I'm here to talk to you about the Vacu-Aide, also known as a QSU, Quiet Suction Unit. Delivers high performance in a compact, lightweight package. Setup is pretty simple. Just connect your suction tubing to the canister, attach your suction catheter, and set your desired vacuum pressure. The built-in gauge gives accurate vacuum readings, ensuring safe pressures for each patient from infants to adults. With consistent controlled suction, clinicians can perform oral, nasal, or tracheal airway clearance efficiently and comfortably.
And my name is Jared Jones. I am also a student at Carrington College, and I'll be going over some specifications on the device. First, we have the adjustable vacuum range that goes all the way from 50 millimeters of mercury to 500 millimeters of mercury. If you need a quiet device, this is perfect for you. It can operate all the way under 59 decibels, making sure it's super quiet and does not disturb your patient at all. It's portable battery operated, so you can use it anywhere, whether you're on the ambulance or at home or even in the hospital if for some reason you don't have a suction unit available. If you can direct your attention to the picture we have for you, you can see the handle on top that helps with transportation. Its compact design makes transport simple, while the interchangeable rechargeable battery provides up to 60 minutes of continuous suction on a full charge.
And now, we're going to demonstrate how to use and set up the Vacu-Aide QSU. Before we start, let's go over the safety precautions. Step 1, wash hands before and after use for approximately 15 at the minimum to 20 seconds. Step 2, use gloves or at home, rinse hands thoroughly. Step 3, keep the unit on a stable surface. You never want to suction for more than 10 to 15 seconds at a time. Always monitor your patient or family for distress, cyanosis, or bradycardia while suctioning. Make sure to always replace tubing and filters as recommended via manufacturing instructions. We are going to demonstrate how the Vacu-Aide QSU works and how to set it up. First, you want to start off by connecting the power cord or attach the battery. Then, you want to insert the collection canister on the side of the device. Attach the lid securely, and don't forget to put the filter directly to the top of the canister. Connect the suction tube directly to the canister to the portable QSU machine. Then, connect the patient tubing directly to the canister to the suction catheter. After everything's done, check that all tubing seals are tight. Now you're ready to turn on the machine. Test suctioning by occluding the tubing tip with a gloved finger. You can also adjust the pressure with the regulator knob. The average recommended ranges is 50 millimeters of mercury to 550 millimeters of mercury for general oral suctioning as an average unless otherwise instructed by a clinician or doctor. Alright, now that we've shown you guys how to set up the suction device, we're going to show you guys how to use it. Pre-oxygenate patient if needed. Once set up, gently insert the catheter, oral or trach, depending on the scenario. Apply suctioning intermediately while withdrawing. Rotate catheter while removing, and then limit each suction pass to 10 to 15 seconds. You want to allow rest periods between passes. Once finished, empty the canister when full, then replace catheter after each use. Alright, now it's time for the cleaning and maintenance. For the final demonstration, we're going to show you how to clean the canister. Alright, start off by emptying the canister and rinsing. Then disinfect according to manufacturer guidelines. Replace hydrophilic filter immediately if wet. Once finished, wipe the exterior with a disinfectant wipe. Once dry, store the device in a dry, cool location. And just like that, you're done.
Hi, nice to see you again. Looks like we made it to the end of the video. Today, we talked about the Vacu-Aide QSU. We talked about the functions of it, what situations might arise when we need to use it, the specifications of the device, and how to set it up. In the beginning of the video, we had a respiratory therapist use it on a patient in an active situation. Then we had the other guys in the video, they talked about how to set it up, and as well as the specifications, right? So let's talk about those events just one more time in a little bit more detail. So we had that first one I mentioned, the trauma patient, right? We had potential blood in this blood in the airway and the secretions that we might need to suction out. We also had the seizure patient with an excess of secretions and possible vomit in the airway. We had Jamal, the respiratory therapist. He was able to go in there and suction out the airway and clear out the secretions, so we were able to save that patient. That was a perfect example of how we were able to use that. So we also talked about the specifications of this device. We talked about the power, how quiet it is, and we talked about the battery life and that it's a battery operated device, so we don't have to worry about plugging it into the wall and don't have to worry about anything like that. So let's go outside and talk about the specifications a little bit more, in a little bit more detail, and maybe the price of the device as well. Actually, looks like we have a patient here. Let's go up there. And I really wish I had a Devilbiss Vacu-Aide QSU to save this patient. Oh, man. All right, let's suction out this airway. Looks like it worked out just fine. So, the Devilbiss Vacu-Aide QSU, like I said, is a quiet, powerful device that we use on our patients, right? Just for a low 4 payments of $99.99, that is just 4 payments of $99.99. We're able to buy that device and have the best treatment for our patients possible, right? Statistics can include the power range, the vacuum range, it's 50 to 550 millimeters of mercury for the power range of this device. We also have how quiet it is. It is only 59 decibels. Much quieter than the other portable devices. We also have the battery range. It's 60 minutes. That is phenomenal. We do plenty of suctioning for 60 minutes and save plenty of patients. This device will last us for a long time. It's a good device, it's reliable, and you should buy it.